I
Oko Boye,
swear by the Almighty God
swear by the Almighty God
that the evidence I shall give before this committee
that the evidence I shall give before this committee
touching the matter in issue
in issue
shall be the truth,
shall be the truth,
the whole truth, and nothing but the truth.
and nothing but the truth.
So help me God.
So help me God.
This committee, as you have been a member before, you already know the mandate, so therefore we expect you to give accurate and tangible assurances that can be verified by the chairman and the committee, so that at the end of the day, the Ghanaian people will know that as you've been a minister, you've been able to account to the good people, and you've done what you have to do as a responsible minister. I thank you very much for your time.
The Honorable Health Minister has 22 issues to respond to and other related matters, because this committee took a decision that public interest questions are allowed and related matters. For example, if we are discussing Agenda 111, committee members are allowed to raise issues related to Agenda 111 that they know about, that are urgent. So, as chair, I would try to manage the time. So if I don't allow probably too many follow-up questions from the same person when others have an interest in the matter, please understand, I will try to be as fair and democratic as possible. Ministry recruits 15,200 nurses and midwives. Process starts Monday. That is Monday, August 5th, 2024. This has generated enormous public discussion. I've read a statement from the president of the Ghana Registered Nurses and Midwives Association, the ever-intelligent and dynamic perpetual Ofori Ampofo, who says that this, your figure of 15,200, she fears that it will create serious challenges on the ground because there's been a backlog from 2021. And according to her, there are over 40,000 nurses and midwives in that backlog. But you have clearance for only 15,200. And you didn't indicate which year, whether it is those from 2021 or those 2022 or recent or all of them. So they are saying that it's led to some chaos. Their offices are inundated. We want to give you the opportunity to clarify what exactly you are doing. Any program that will create jobs for our young people, as MPs, we are happy about it. We come under a lot of pressure from unemployed graduates in our constituency. So a lot of interest. Many people want to know what the ministry is doing. How do you reconcile the concerns of GRNMA that you should be clearing all the backlog and not only 15,200? How did you come by that figure? What is the criteria of only 15,000 and not the entire backlog of 40,000? So, Honorable Minister.
A few decades ago, Ghana, when it comes to training of nurses, almost all the nurses are trained by the government through health training institutions. Over time, the universities had programs that could give other qualifications to our health workers, specifically the nurses. It was quite easy to plan employment for the nurses, all of them, when government was almost the only person training them. But sophistication and development comes with challenges. As we accredit private facilities to train nurses, even now straight from the university, you now have a situation where the numbers that come out is way sometimes beyond the number that government trained or would have trained. So I think for our recent history, governments, when they give clearance, doesn't clear all those nurses who are at home. But rather what happens is that those who have been home for the longest time are absolved. So as we speak, most of the nurses that find themselves at home, who have been at home for quite some time, are the 2020 nurses. Those who finished school in 2020. Now, when a nurse finishes school in 2020, they will do rotation, which is the equivalent of their service for a year. So even in 2021, they would have still been engaged, more or less, in the hospitals. But that's when they take their allowance, what they call allowance. And then, after 2021, that is when they more or less become redundant. So a 2020 nurse would become redundant when you start 2022. So they've been home more or less 2022, 2023, which is a 2-year period. The nurse who finished school in 2021 would have done rotation in 2022 and would have become redundant in 2023. For fairness sake, these clearance, it's supposed to target largely those who finished in 2020, did their service or rotation in 2021. But what has been happening in the ministry is that over the years, when you give clearance for a particular year, the last one that came, which was also in the thousands, was for 2019. But some 2020 nurses, those who committed, were engaged because not all the 2019 take up the post. Some move into other professions, some might have emigrated, some, for some reasons, might not take it up. Honorable Chair, so even some 2020 nurses who are the target of this clearance are already working and employed by government. We are first going to give the opportunity to the 2020 nurses. And then some window, especially for those spaces which are likely not to have been taken up by the 2020 nurses, to a nurse who might have finished in 2021 or 2022. I believe in fairness in what I do. It's not fair for someone who finished in 2020 to be at home, for you who finished in 2023 or 2022 to get a job. So we will manage the process such that the majority, overwhelming majority, should have been those who have sat at home for the longest period. And then that is what to do. Definitely, even when all get employed, this number, you still have some that are redundant. The next clearance that comes, they will be the next target. And as a country, I think going forward, sustainable way of engaging healthcare workers. Respectfully, when teachers finish school now, because more or less they are degree programs now, they look at the world of work, not the Ghana of work. So that anywhere a teacher is needed, whether in South Africa or Bulgaria or China, once you are qualified, you take on the world. Going forward, as a country, we cannot have the space to say that for every nurse or health worker that is trained, we automatically absorb them. We should rather set the conditions such that they are fit to operate in various jurisdictions globally. And many nurses on their own end up doing decent job in, let's say, UK, US. There are a few programs which are bilateral programs. Barbados, for example, came to speak to Ghana government that we've heard about your health workers. We want Ghana nurses. First cohort went. Apparently, they are doing wonders. They've come for a second. The ministry is working on a third cohort. I met officials from another island in the West Indies. They now also say they want cohort. So the point I'm making is that whichever government is there, we are training more now than you can swallow. And by the way, even in our hospitals, there are some facilities now that there are more nurses than, clients. So I think as a sustainable way of giving them opportunities, we should open the door for them to be absorbed within and across the world. Thank you.
Can you share some official numbers with us on how well we are doing with the nursing population ratio? Where are we in terms of the WHO standards? Have we met those standards? What's the latest statistics?
Thank you, Honorable Chair. I don't have the exact figure, but the last time when I participated in a program, I think in Namibia or so, Ghana is one of the few countries on the continent that has the recommended nurse-to-patient ratio. The doctor-to-patient has improved drastically, just that I think it's not at the level of middle to upper income country. But for nurses, in fact, recently a market analysis was done. Ghana has crossed the recommended threshold, and we actually have more nurses. It is the distribution that is not perfect. distribution as in, we are MPs. Most health workers will approach us that they want to work in Accra and Kumasi. So it's the distribution. So you come to some health facilities in Accra and Kumasi and Takrady, and there are more nurses than the patients who are coming. A health center has 10 midwives. Meanwhile, they see few women a day, 2-3 women. Yet you cross to Salaga or to Tolon or Norton, and then you have one nurse midwife who is working 24 hours. So, Honorable, it is the distribution. But in terms of the ratio, average ratio, it is healthy. Yes.
So, Honourable Minister, what assurances can you give this committee on the recruitment that it will be fair, very transparent? We are not going to hear protocol recruitment. Some party chairman has a quota and is selling it, and people have to pay. Like we are hearing about other recruitments going on in the country. What are the safeguards you have put in place to make sure that this will be fair recruitment? Because 15,200 is a good number. If it is done fairly, I think that we can be able to absorb some of the pressure.
Honorable Chair, let me thank you. And I didn't know that more or less we're going to discuss this. But this matter is so important that the last person I met before coming here was my director of HR. And I told him in plain terms that I know in the past you hear rumors of someone paid this, someone did that. And I told him straight away that if he needs any help, or I have to give him intelligence officers, I'm ready to support him so that it is done fairly. So I told him that there is a way that when you do things, the ordinary man on the street will say, I got in fairly. And I encouraged him that an overwhelming percentage of our recruitment must be in that particular form. As for, they say culture, because of the system we work in, and I mentioned Honorable Bagbin because he's my father. If Honorable Bagbin calls me the doctor, there's a nurse at my constituency, he's settled for 4 years. Because of our setting as a country, sometimes you ask, what do I do to support that person? But an overwhelming percentage of these people, that has been my practice everywhere I go. And I told him I'm ready to help him with intelligence officers because the system we run, sometimes you, the minister, means well. And you have people who are probably outside the system or in the system, know people, and they have their own mechanisms of trying to undo the system. So that's why I told him, let me know how I can help you. Because I'm not interested in making money from this process. I'm happy when I meet someone I don't know who says that, thank you, Minister, I got employed. And so I'm with you, Honorable Chair. We are going to be very fair to the process.